Lexi. I'm going to be your nurse today. I'm going to wash my hands, going to provide for privacy. So today, could you tell me your name and date of birth? Okay, so I check my MAR and it matches up with Eugene Williams, and then I go ahead and check here and I can see that's right. Do you have any allergies, Eugene? Yes, to betadine and codeine. Okay, well today I have an order for furosemide, so we're gonna go ahead and give you that through IV push today. So so for that, I did my math and it came to 1.6 milliliters. And then I checked the Betty book and it is compatible. And the reason that you have a central line is because we weren't able to get an IV on you yesterday. So this drug is compatible, and then it can be given undiluted. An appropriate dose for the patient is correct, and it can be given over 1 to 2 minutes. And then some adverse reactions to check for would be blurring of vision, headache, itching, lethargy. So tell me if you feel any of those, okay? So some considerations that we might have for this procedure would be if the patient was a pediatric patient, we make sure to have their parent in the room. And for all of the IV lifespan considerations, usually like for blood, we might use like a smaller size needle, so 18 gauge instead of 22. And then for the IV piggyback, we'd once again have someone else in the room, like their parent. And then I'm going to assess for understanding for this patient for all the procedures. So I would make sure that the patient understood and ask them if they have any questions, and if they, I would go ahead and have a second nurse in the room if they couldn't hold their hands still, their arms still, while I was giving them IV medications. So, and then for this one, if there was a heparin flush, that I would make sure to take out the heparin before I administer their furosemide. And then if there was a cap that was like sterilized, I will go ahead and take that off and then put it back on after we are done. And then I'll go ahead and unclamp the central line IV before I would give them medication, and then clamp it after. So there is no clamp in this case, so that's why I'm verbalizing it. And then, so next what I want to do is I want to get dose accurate for our furosemide. So, going to wash my hands, and then my math came to be 1.6. So I want to go ahead . Do my checks. So I have then I'll verbalize that I'll get all the air bubbles out. There's just tiny ones in there. Now I want to go ahead and recap. So I got all of the air out, as you can see I just did. And then now next what I want to do is I want to assess our site over here. So I'm going to wash my hands, I'm going to go ahead and put on my gloves. But before I do that, I'm actually going to do my 3 checks, just so we go in the proper order here. So after my checks, I'm going to put my date and the time on here. So we have furosemide, 4 milligrams IV push times 1 dose to be given, and I can see we have our correct amount here. We have 1.6 according to the math, given between the first and second unit PRBC, so it's due. And then this is for Eugene Williams, allergies, betadine, and codeine. So the client is Eugene Williams. We have allergies, betadine, and codeine, and then a checked expiration date on this, and this is good to go. And then we have furosemide, for 40 milligrams, which is 1.6 milliliters according to my math, and IV push times 1 dose to be given between the first and second unit red blood cells, so it's due, and then check expiration date. So we have Eugene Williams, allergies betadine and codeine. We have furosemide 40 milligrams, IV push, which comes to 1.6 milliliters every 2 hours PRN, to be given furosemide 40 milligrams, IV push times 1 dose to be given between first and second packed red blood cells, and it's due. So I did that 3 times. Now what I want to go ahead and do is assess my site. I'm going to wash my hands. Going to don my gloves, and then the side effects we want to check for be blurring of vision, headache, itching, lethargy. So while I administer the medication, I want to go ahead and check on those. But before I do that, I want to check the expiration date on each one of my salines, and then get the air out. So we have 10 milliliters. Bring these over here by the bedside. And then I want to go ahead and bring all of my alcohol wipes. Okay, so now I want to assess the IV site. So I would make sure I took off my gloves and then wash my hands and then put new gloves on before I touch my IV site. So I'm going to check the IV site for any infiltration, any extroversion, any inflammation, or dislodgement. So I don't see any today, so we're good for that. And then I'll go ahead and I would take off my gloves and then discard them, and then put some new gloves on so that we're good here. And so I have my 3 saline flushes. So what I want to go ahead and do is I would label the date and the time for my furosemide, but I want to take my lumen over here. So we're going to document that we're going to use this lumen, the blue one, for this. I would cleanse the alcohol wipe for 15 to 30 seconds for agency policy, allow it to dry. And then I want to go ahead and take my first saline flush, and then take my 10 milliliters. And then we'll verbalize that we did the entire 10 milliliter flush. And then I'll make sure to take off I would make sure to allow the cap I would administer the 10 milliliters, and then I would go ahead and twist this off, and then I'd discard this, and then the clamp is what I was talking about. So I make sure before I did that I would undo the clamp. So now what I want to do is I want to go ahead and grab my second alcohol wipe. And then I would go ahead, cleanse that for 15 to 30 seconds, allow it to dry per agency policy. Then we're going to go ahead and give the furosemide over 1 to 2 minutes, okay? And then while we're doing this, we're going to monitor for the adverse reactions that I talked about earlier. So I'll give this over 1 to 2 minutes. So the adverse reactions we check for would be blurring of vision, headache, itching, and lethargy. Are you doing okay here? Yes? Okay, good. And then I'm gonna verbalize it. I would give that over 1 to 2 minutes. Then I would go ahead and discard this. Then I would grab my other alcohol wipe, and then I would swab 15 to 30 seconds, allow that to dry. And then I want to grab my other saline flush. So this one, what we want to do is also give it over 1 to 2 minutes. Allow this to dry. I'm going to give that over and verbalize that I gave the whole 10 milliliters. And then discard that. And then what I want to go ahead and do is I want to take my alcohol wipe. So in between each of these, I want to make sure I use my alcohol wipe, and at the end, so to allow that to dry.
So I'm going to measure my
I have my last one.
to compare with the baseline measure.
And then this one, we're going to go ahead and give a pulse flush because it's a central catheter. So you pull back on the plunger as you go, just tiny little pulses. I verbalize that I give that, and then I go ahead and twist this off, verbalize that I would throw that in the garbage, and then I'm gonna go ahead and take another alcohol swab this per agency's policy, allow it to dry, and then recap the needle, and then the lumen, and then go ahead and if I would take the to like slide it to put it the clamp back on. So now what I want to do is I want to dispose of all my supplies, and then I want to go ahead and still monitor adverse reactions, and then I would document which lumen that I used this administered the medication, what I administered, my assessment findings, so my IV site that I assessed, any abnormalities, the amount of medication I gave, how the patient tolerated procedure. I would document the amount of milliliters I used, and then I want to dispose of all my supplies here, and then I'd go ahead and go to my next skill. So I take off my gloves, wash my hands, and then I want to go ahead and explain my next procedure. So what we're going to do next is we have packed red blood cells that we're going to administer. Do you have any questions? No? Okay. Well, we have our normal saline right over here, and we have our tubing. So I've gathered all my supplies, and then for the last one I also gathered all my supplies, and then I wanted to go ahead and I want to check my expiration date on the normal saline, and that's good. I don't see any cloudiness, and that's all set. And then I want to go ahead and make sure that I get my informed consent for this procedure. So I can see for the last skill, I also checked to make sure we had an order. And for this blood administration, I want to make sure that we also have an order, and we do for blood. So next, what I want to do is make sure I have my informed consent. So do you have any questions about your other options for treatment? No? Okay. Okay. Verbalize and assess for understanding, and then I would go ahead and I would make sure I grabbed my blood within 30 minutes of administering my blood, and then I would make sure to use a gauge needle that's anywhere from 18 to 22 gauge, and then I would go ahead and I would verbalize what would happen in a transfusion reaction. So in a transfusion reaction, what we want to check for would be a headache, an itching, and then like nausea, and then back pain. So if you have any of those, Eugene, I want you to let me know, okay? Okay, so gonna verbalize that I did not leave the room in between like these two different things, and then I would make sure that if a transfusion reaction were to occur, then I would make sure that I would turn off the blood immediately and then allow the normal saline to flow through, and then I would go ahead and notify the MD. And then before I administer blood, I want to check to make sure that the IV is patent. So I pull back and then make sure that I would also administer normal saline before giving the blood. And then I would make sure to also find vitals and then assess for lung sounds for this patient. And going to now go ahead and set up my pump for my normal saline. So I have my tubing over here. I want to make sure that I wash my hands, and I'm just gonna put on gloves because I feel more comfortable with that. So I'm gonna go ahead and turn, make sure that I have this locked, my clamp, and then I want to go ahead and
here, I would activate this by squeezing it, and then I want to use vigorous friction.
I would assess my IV set again to check for infiltration, dislodgement, any inflammation. So I'm going to verbalize that I went and did that with this procedure once again. This normal saline bag does not go in easy.
I would discard that. And the next thing I would want to do is
Okay.
dressing here.
So have it clamped.
And I want to make sure that it's dry before
I'm gonna go ahead
dressing.
and I want to squeeze the drip chamber to make sure it's above
Change the ejection
the
cap,
filter,
whatever my agency
and then
policy is
I
on
want to make sure I get all of the air out of this line. So
patch for this procedure. Okay, so I'm going to touch only the outsides here. And then apply this dressing.
alright, so I can see that we're getting the air out. So now I want to go ahead and clamp the normal saline, because you don't want the blood to run with the normal saline, so I'm just going to go ahead and leave that there for now. So now I'm going to take off my gloves and then wash my hands. And then what I want to do is I want to get another nurse. So I want to make sure that I invert the bag several times and then check for blood clots, check the color, check for gas bubbles. I don't see any of that. So I check the expiration date, we're good on that. And then I would go ahead, grab another nurse, And then we would go through the blood transfusion order. So we have med record number 89654, med record number 89654, location HLRO, location HLRO, count number 0001563, count number 0015603, patient name Eugene Williams, patient name Eugene Williams, date of birth 9/22/1945, date of birth 9/22/1945, red armband number 6762, red armband number 6762, and I checked to make sure that's right on our patient, and that is. Patient blood type AB positive, patient blood type AB positive, compatibility test completed, compatibility tests completed, and then we have the donor pool number here, 5166, donor pool number 5166, patient blood type is AB positive, patient blood type AB positive, units in pool 4, volume to be infused is 275 milliliters, volume to be infused 275 milliliters. So we've done all of our checks, we checked the expiration date is good, so I'm good on that with my nurse or doctor that I could use. So next what I want to go ahead and do is I'm going to wash my hands, and then I already checked my IV site. I'm going to do my gloves.
I think I just might do it again, just so I can look at them and say, oh, which ones I like better. I feel like I forgot a lot of stuff because.
And then if there was a warmer, then I would go ahead and use that for this patient. But in this case, we don't have that. And then if there was like a filter, we go ahead and use that as well. So next what I'm going to do is I want to take my blood bag, and then I'll take that over here.
So, like, I remembered when I watched the skill with Anna and the medication. Okay.
I want to spike the blood bag.
I was looking at it, I'm like, well, it's a few minutes, it's not going to get blocked.
Like it could stay right here.
Yeah.
And nothing would flush it.
Right.
So yeah, that was smart.
Yeah, so I was like thinking, well,
That was really smart.
yeah, so I guess what you do is, use this, because that's what she did in the video.
And then I want to allow the drip chamber to be filled. And I'll unclamp this. Just the blood, leave this. Normal saline, leave that clamped. And then after the blood transfusion, I go ahead and use normal saline, allow that to flow through. I want to make sure that I get all the air bubbles out of my my line. And once I see blood over here, then I would go ahead and stop. Alright, so I've gotten all of I can see the blood here at the tip. And I'm going to go ahead and clamp this. And then I want to get this hooked up to the patient. So I'm going to take my normal saline, or my alcohol swab, and this time we're going to use the red. And then I would go ahead and do the 15 to 30 seconds for agency policy, allow it to dry. Alright, so it's all hooked up, and then before I begin, I want to make sure that I go ahead and get this in here. I would do this before I'd hook it up to the patient. So now what I want to do is I want to turn it on. have packed red blood cells. I'm going to go at a rate of 50. And the volume to be infused, we want to make sure we get all of the red blood cells. So we want to go ahead and use the full 275. And now before I begin, I want to go ahead and unclamp. And then I would start my infusion. Alright, so I would allow it to go, and then I would stay with my patient for, I'm going to turn this off just so it doesn't beep. I would make sure to monitor my patient for the first 15 minutes, and then I would go ahead and change the rate whenever the 15 minutes is up, depending on what the agency wants me to. And then I would stay with the patient and check them every 15 minutes to half an hour. And then I would make sure that I would allow the normal saline to go through after I was done giving the blood. And then I would make sure to document my findings and then dispose of my supplies. So what I would document would be how the patient tolerated procedure, the assessment of the IV site, which lumen was used. We used the red one. I would document everything up here on our simulation, like this entire table here that we went through with the nurse. I'm going to take off my gloves and then wash my hands. I would also document the gauge needle that we used, so we use 18. And then I would document how patient tolerated the procedure, and then I would document the date, and then the time, and then my initials. And then I wash my hands, and then we're gonna move on to the next skill. And I'm still gonna stay in the room. How are you doing, Eugene? Oh, before I would never touch blood, so even when I'm doing this, I would want to make sure that the blood go in the biohazard bag and make sure to wash my hands, and then whenever I'm dealing with blood, I always want to have gloves on. So I'm just going to do that for the purpose of what we should do. And then the tubing should be changed every 4 hours. And we want to use the blood within half an hour when we take it out. So I dispose of all my supplies. So I'm gonna put them over here. And then after I was done, I would also make sure that I would check for a transfusion reaction. So while the blood was administering, I'd also check for the transfusion reaction within the first 15 minutes and then continue to check after that. So I would continue to check for vital signs, the lung sounds, for any dyspnea, any itching or headache. And now I have my last IV skill that I'm going to go ahead and do. everything out of the way here. Okay. So, gonna take off. I would not touch anything after after putting my gloves on. I would go ahead and discard these right away before touching any of my supplies. And I'll go ahead and wash my hands, but now I'm gonna touch my supplies. So, I am going to wash my hands, and then, so our next, the last skill that I'm gonna do on you today, Eugene, is I'm going to administer pantoprazole, okay? So that's a proton pump inhibitor that will help with your stomach. Some adverse reactions that might happen would be a headache, a rash, and confusion. And your rate that we're going to give this today is appropriate for you, and so is the dosage. And then I went ahead and did my math, and it was 25 milliliters per hour. And so that's compatible with all the other medications, so we're all set to go. So next what I want to do is I have all my supplies ready here. So for this skill, I'd make sure to change, after I'm done with hanging this up, I'd make sure to put the date that the tubing needs to be changed on the tubing, since I'm using new tubing today. So I'm going to go ahead and I'm going to do my rights. So today we have pantoprazole, 80 milligrams and 250 milliliters of normal saline. So I checked my MAR, and then I checked the expiration date, and it's good on here. Okay, so we have Eugene Williams, allergies to betadine and codeine. We have pantoprazole, 80 milligrams in normal saline, 250 milliliters, 0.95 normal saline, to infuse at 8 milligrams per hour. So we're good on that, and it's due. And then, so we have, so expiration date's good. So Eugene Williams, betadine, allergies to betadine and codeine. We have pantoprazole, 80 milligrams and 250 milliliters, 0.9 normal saline, to infuse at 8 milligrams per hour. We did our math, and it'll be 25 milliliters per hour. We have Eugene Williams, allergies to betadine and codeine. We have pantoprazole, 80 milligrams and 250 milliliters, 0.9 normal saline, to infuse at 8 milligrams per hour, and it's due. So next what I'm going to do is I'm going to go ahead and check here, make sure that my bag was normal and it has the appropriate color, no gas bubbles, it's not leaking, so we're good on that. So next I'm going to wash my hands, and then because it's a medication, I want to go ahead and don my gloves. And I don't need to. The normal saline. Okay, so I'm going to take out my tubing. So I've gathered all my supplies, and then I want to go ahead and I would assess the site once again. So I'd make sure that there's no infiltration, if there was any dislodgement, and I would assess the site with my gloves. I can see that there's absolutely none. And then what I want to do is I want to go ahead and I want to take this, and then I would go ahead and spike my tubing using sterile technique. And then I'm going to go ahead and make sure that I have this is clamped before I would spike the tubing, and it is clamped. So next what I'm going to do is I'm going to hang up my medication.
It's going to be about 8
ahead and squeeze my drip chamber, which I have. And then after I'm done, I'll make sure that I see at least 3 drips for this medication before I would leave. And then I'll make sure that I get all of the air bubbles out. Alright, so all the air bubbles are out. Now what I want to do is I want to clamp, so we're not wasting any medication. And then what I want to do is I want to hook it up to my person here, Eugene. So Eugene, I'm going to go ahead and I'm going to take an alcohol swab, and we're going to use your blue lumen, and then I'm going to go ahead and we're going to, before I do that, make sure I have this in my hand. So I take a new alcohol swab and take that out, and I'll go ahead. Alcohol swab per my agency's policy, 15 to 30 seconds, allow it to dry. Using sterile technique, I'm not going to touch anything with this. And then I'm going to go ahead and uncap this. Okay. So next what I want to do is, I got all the air out of my line. So I'm going to go ahead . And I would start up my machine, and then because we don't have this medication in here in the appropriate dose, I'm going to go ahead and I'm just going to choose the 0.9 normal saline, but I understand that in the perfect world we will go ahead and find pantoprazole 80 milligrams in 250 milliliters of 0.9 normal saline. And the expiration date's good because I checked that. So go ahead, 0.9 normal saline is correct. And then we have 25 milliliters per hour. I'm just gonna make sure that that's right for my math, and it is. And then the volume to infuse is we're going to do 225, so we make sure we can check it in time. And then going to go ahead, take off my clamp, so that's open, so we don't get any air in the line. I'm going to go ahead and start. We're good on that. So I'm going to go ahead and turn this off and pretend that we did the entire medication. And while I'm administering this medication, I would want to make sure that I check for the adverse reactions that I talked about, and then be monitoring the vital signs. And then I'll dispose of my supplies. And then I would go ahead and I document my findings. So I'm first going to take off my gloves and I'm going to wash my hands. So the findings that I document would be which lumen that I use, and then the drips that I use, the amount of milliliters that I use, and then how the patient's site, their IV site, And then how the patient tolerated procedure, if they had any adverse reactions. I would document which lumen, like I said, and then I would go ahead and make sure that I changed the tubing, and I would label the tubing with the date that needs to be changed, and then I would go ahead and the other things that I document would be the date and the time and then my initials, and then I would document the arm that we did all of these, where the IV site was for all of these like medications that I administered today. And then I would make sure that the patient would be in a comfortable position, so a low-lacked position with their call light in their hand. And I would make sure to wash my hands before I left the room. And then I would go ahead and dispose of my supplies, and then consideration, lifespan consideration, I would, for this one would be, if there was a pediatric patient, then I would go ahead and have a second, their parent in the room, and I would assess for understanding before this skill, so I'd ask if there is any questions, and then dispose of my supplies, and then wash my hands, and then I'm done with this procedure.